Dr. Vaccaro, how many different types of spine surgery are there?
We have hundreds of different spine surgeries, from the front to the back, from the skull down to the tailbone.
What are the most common?
The most common that most people know about is something called a microdiscectomy. We make a small little opening and we take a fragment of disc that has broken off, impinging on a nerve root. Some people call that an open discectomy, some people call that a discectomy, some people call that a microdiscectomy, and even people call it a percutaneous microdiscectomy. So what it is, it's minimal soft tissue disruption to access the spinal canal where the nerves are, and the disc, which is a shock absorber, just breaks off and presses on a nerve root. And we go in and we just remove it.
By taking it off, you're then taking the pressure off that nerve root.
Right. And what causes pain? Pain is a combination of compression, which causes neural impingement, lack of blood supply, and the inflammation from the disc. When a disc breaks off, it causes this autoimmune process, and it's the inflammation that really drives people crazy. Now, fortunately, the vast majority of people can get better with time.
So that's microdiscectomy. I think you also mentioned a laminectomy. What's that?
Laminectomy is the bony covering in the back of the spine. Sometimes we remove that to access the nerves.
And then you also talked about fusion. What's that type of surgery?
A fusion is when you mend two vertebral bodies together. We usually use screws, rods, a plate, but really we're putting bone between two vertebral bodies to stop motion so they can grow together.
So when you talk about the fusion part, what are you using to fuse the bones together?
Sure. So people think of screws and metal and plates. Those are just adjunctive tools we use. When you fuse one vertebral body to another, you need bone. So we could take bone from the patient's body and transplant it from the iliac crest, the tibia, or we could take a bone from a cadaver, which is very common in America, take a bone from a cadaver, or we could take a cage. It could be a piece of metal, polymer, and we could fill that with bone. And that allows the bone to go between two vertebral bodies, and that's a fusion.
When a patient's in the operating room, they're asleep, I would assume?
They're asleep. Now, we can do spine surgery with them not being asleep. So you have the option. So I've done spine operations where I've given someone a local anesthetic, a spinal needle, so only the lower portion of the body is asleep. We don't like to do that for a couple of reasons. Number one, the patient's awake and there's movement. And when there's movement, there's muscle spasms. And we like to do these minimally invasively, so we like to have the muscles relax so we can part the fibers and not cut them. So even though we can keep you awake, we would prefer not to. Now, if you're operating above the waist, thoracic, cervical spine, you're asleep for that.
If they're asleep, they're obviously not seeing what's going on in the operating room, but why don't you tell us a little bit about what does go on while they're sleeping during the surgery?
We have a team, just like when you get on an airplane. We have the lead surgeon, we have the nurse anesthetist, we have the anesthesiologist, we have a scrub nurse, we have someone circulating, we have a whole team that works together to ensure the safety of the patient.
You didn't mention neural monitors, and I know that's something that sometimes is in the operating room. Can you tell us what neural monitors are?
When people hear neuromonitoring, it's a safeguard to protect the neural elements, which is the spinal cord and nerve. We can protect the back of the spinal cord, the front of the spinal cord, or the nerves, and we use this electronic apparatus that puts circulation, electricity through the nerve roots, so we can see if that gets disrupted to tell us we're irritating a neural element.
Because you want to make sure that while you're working on the discs and you're working on the bones, that you're protecting the spinal cord at the same time.
Correct.
And ultimately, what is the ultimate goal of the surgeries that you do?
Number one goal, happy patient. Number two goal, safe, happy patient. So we want to take pain away and we want to improve function.
Dr. Vaccaro, thank you so much.
You're welcome.
If you have questions or would like to schedule an appointment with a Rothman physician to discuss both non-operative and operative treatment of your spine, please call 1-800-321-9999 or request an appointment online.